Hi everybody, welcome to Shocker Nursing. I'm really excited that you're here and congratulations on your entry into the nursing program and the nursing profession. My name is Brandy Jackson and I am the director of the undergraduate nursing programs. We're going to start with Module 1 of your new student orientation. So let's just jump right in. So at the end of this video, you will be able to explain practicum expectations, examine unsafe practicum behaviors, identify reasons why a student may be removed from practicum and the consequences of removal. So what are the expectations before you arrive to your practicum site? Well, first you need to be prepared and have all of your assigned pre-work completed. Not every practicum has pre-work, but several of them do, so that needs to be done. You need to have received adequate sleep. You need to have been adequately hydrated, eat breakfast so that you don't pass out. Be ready to focus your attention on the patient. As you get into nursing school, it's going to get really busy. You're going to be a college student. You may have things outside of college, family obligations, work obligations. You're going to have exams and projects and papers and all kinds of things that are going to pull you in a lot of different directions. But you have to have the ability to leave all that behind for a few minutes and focus your attention on the patient so you're not distracted. Personally, I practice mindfulness for this, and sometimes I just have to stop for a few minutes and center myself in the moment and remember that I can't change the past and I can't influence the future at that moment, so I can refocus on the patient. Make sure that all your practicum requirements are up to date. We've talked about this before in your readiness meeting that we had a couple of months ago, and you've gotten several emails about this, so please refer back to that information. Make sure your ID is on and you have it with you for practicum. Personally, I will leave my ID laying on my kitchen counter. I just know that about myself. So my ID lays in my car all the time. And so it's habitual for me to take it off at the end of the day, put it in a little place on my dashboard, and then it's there when I come back the next time that I need it. And make sure you're wearing a clean school-approved uniform. Guys, scrubs do not lay well in a dryer overnight, so make sure that you've planned time to wash, dry, and hang. You don't want to arrive at practicum looking like you slept in your scrubs. So what about during practicum? And by all means, this is not an exhaustive list. These are some points I pulled out of the handbook that I felt were salient. Arrive on time, super important, can't be tardy. Patients are there 24/7, and the night shift or the day shift or the previous shift is waiting on you. You need to be there on time. Be ready to put your awesome nursing knowledge, skills, and behaviors to work. When you start practicum, you will already have had a semester of nursing school and a lot of knowledge to bring to the practicum. And so how exciting is it that you get to put that knowledge to work? So be ready for that. You're going to demonstrate the application of that knowledge that you obtained in first semester and that you continue to obtain throughout the nursing program. Always self-evaluate and be reflective. Think about what went well, what didn't go well, how you can improve. You should always be in a self-evaluation state of mind and always stay curious. And of course, you're going to need to adhere to policies and procedures, and all of our practicum sites have policies and procedure manuals that are online, and a bedside nurse or a faculty can always help you pull those up. And we also have our handbook, which has those policies and procedures in that as well. You're going to practice professional conduct. You're going to learn about professional conduct as you start the nursing program. In fact, one of your first classes centers and is completely on professionalism. So you're going to learn that as you go along. Take responsibility for your learning. No one else is responsible for your learning except you. Your faculty is not responsible. I'm not responsible. The bedside nurse is not responsible. You have to be responsible for your own learning. We can help facilitate your learning, but obviously we can't make you learn something. So take that responsibility. If you have some downtime in the practicum, which doesn't happen very often, but it might, go find something to learn. Go seek out something that you want to know. Maintain HIPAA compliance, and by all means, always ask for assistance. If you don't know, ask. Much rather have you ask. There are no stupid questions than to cause harm or put a patient in harm's way. So, are you safe to practice? That's a question you should ask yourself every morning that you wake up. Am I safe to practice? And you should ask that question throughout the day. Am I safe to do this? We're going to take a little spin on that, and we're going to talk about what are some things that look to be unsafe. So, not being prepared. If you're not prepared, if you've been given pre-work and you've not looked up that pre-work, then you're not safe to be in practicum. There's a lot of research around civility, bullying behaviors, and how that relates to patient outcomes. And the research is telling us that those types of behaviors create an unsafe environment, which then impacts patient outcomes, not in a good way. Absent from the unit. Well, you're obviously not taking care of your patient if you're not in the unit. If you do not properly communicate, we're going to teach you some really awesome communication tools right off the get-go within the first couple of weeks of the nursing program. And you will have opportunities in simulation to practice those. So you will be able to recognize and understand some really strong communication techniques that you can use in practicum. Habitual or unexplained tardiness or absent episodes, that's a safety concern, because we have to start asking, well, why is someone tardy a lot? Why is someone absent a lot? Are they ill? Is there something else going on? Do we have a drug or alcohol issue? So those things kind of tie together. Presenting to practicum without proper rest. If you're a night shift worker, you should not. I really will make the stand that says you cannot work the night before your practicum. I was a night shift worker when I was a student, and I planned my nights to be on Friday and Saturdays. I didn't have any class on Friday, and I didn't have class on Saturday, and so that was okay. But you cannot go to an all-night shift and then come and do practicum that following. That's a double shift, and that is unsafe. There's a lot of literature that says that's unsafe, and you will be sent home if that's discovered. So what are some characteristics of unsafe behavior? Defensiveness. So let's talk about that a minute. So why is that connected with unsafe behavior? If you're defensive when someone is trying to provide you feedback about anything, if you become defensive, then you are not learning or listening to that feedback, and that feedback is given to you so you can change something in order to be safer or improve. So defensiveness puts a block, like shields up around us, and then we're not gonna listen to any incoming input. And we've all been there. We've all been defensive. And if you think about those times where that's happened to you, that analogy of shields up is probably pretty true for everybody. Work ethic, poor work ethic, dishonesty, overconfidence. The overconfidence, you want to always be in the frame of learning and growing and asking questions. I've been a nurse for many years, and I've never achieved overconfidence, nor do I think that I will ever achieve overconfidence, because this person that's overconfident is scary. And I know you probably know some people like that. You will always be learning, and you will always be growing, and you will always be asking questions. You cannot know it all. Attitude problems, inability to follow instructions. Your life as a nurse centers around the ability to follow details and instructions. You will be implementing the provider's orders. You have to be able to read those. You have to be able to follow those instructions. You can't just decide to go off on your own and not follow them or misread them or things like that. So you have to be able to follow instructions. So these are some examples of what might precipitate removal from a practicum site or a practicum day. No name badge or your clinical requirements aren't up to date, you're going to be sent home. If you're not in the right dress code, you're going to be sent home. Clearly, if you're under the influence of drugs or alcohol, you're going to be sent home. A HIPAA violation, that can result in dismissal from the practicum site and dismissal from the program. Misuse of property or technology. So let me give you an example of that and how that might tie into a HIPAA violation. Let's say you have paperwork to fill out, you have your charting to do for a patient, and you need the patient's lab results. So you pull it up on the computer screen and you snap a picture with your phone because you don't have time to do it right now, so you're going to input it later. Well, first of all, that's a HIPAA violation. Second of all, that's clearly a misuse of property or technology. It is not your property to take, and it is not appropriate to take pictures of a patient's anything with your phone. Unsafe behavior or performance, we talked about that a little earlier. Tardy and absent, we've talked about that. Inability to practice safe medication administration, you will learn all about how to do that in your first semester of the nursing program. That you will practice and practice and practice and apply and apply and apply over time, and almost everything that we knew. You will have them in your exams, you will have it in your simulations, you will have it in lab, and clearly you will have it in clinical. So you have to provide safe medication administration. So faculty, the practicum instructor, the faculty, they're going to talk with you when they're seeing unsafe practice. As we talked about earlier, there's going to be some things that get you sent home, but there are some things like tardy, absenteeism, vacation administration, some things like that, that the first time maybe the faculty sees it happen, they're going to sit down and talk with you about that. And they're going to expect you to change your behavior. If you don't, and there's a pattern, that could result in dismissal from the program. There are some things that are egregious, some violations that are egregious that may put you in a position where you are sent home pending an investigation. Those are few and far between, but they can happen. The handbook outlines those a little bit more closely, so please make sure you're reading that. Also, please know that a clinical agency, they can dismiss you from the entire clinical agency for unsafe behaviors. And that is at their discretion, and they actually have a legal right to do that. So what happens if you are removed from a practicum? Well, if you show up without your ID and you can't easily obtain it and you're sent home, you're going to get a 0 for the day. So our practicum rotations are standard letter graded, so A through F, so a 0 definitely could affect that. In the case where you are dismissed from a hospital site, or there's other problems that are much more egregious than, forgetting your ID badge, then you could have delayed progression in the program, or you could be dismissed from the program. There are some situations where there's university sanctions consequences. The one example that I can provide to you is under the influence of drugs and alcohol. That is in direct violation of the Student Code of Conduct. So in that case, the university Student Code of Conduct office would be involved in that. And so you would not only have to report and talk with that office, but you would also have the consequences and the investigation from the School of Nursing and potentially from the hospital as well. So thank you for taking some time with me today. Please take note of any questions that you might have over this content, because you will definitely have an opportunity to ask some questions in our upcoming Zoom meeting. And your next step is to move to Module 2. Have a great day, everybody.